Bipolar disorder, also known as manic depressive disorder, is a mental condition that's characterized by interchanging periods of extreme and intense mood swings. If you suffer from bipolar disorder, then you know how frustrating and hard it can be to fit in with normal everyday life. At one point, you're getting the feelings of over-elatedness and mania, followed by a period of depression and feeling down. With all that we know about bipolar disorder, there are still many false beliefs concerning the condition. Many of these misconceptions involve how people behave while in a manic or depressive episode. Some of these interpretations are just exaggerations of the actual condition, while others are an outright fabrication. In this video, I'll tell you what bipolar disorder is and what you can do to make your life easier. It's a world of two different realities, elation and depression. Millions of people around the world are suffering from bipolar disorder. It's estimated that 1 in 10 people will suffer from this condition. But sadly, bipolar disorder sufferers are still misunderstood and often struggle to fit in. You find it difficult to balance between the two extremes, which is necessary to lead a healthy and fulfilling life. For type 1 bipolar disorder sufferers, manic periods are characterized by restlessness, the feelings of invincibility and sleeplessness. You find it hard to control your emotions and find a balance between what you do and what's socially acceptable. With type 1, these highs go to extremes. These manic episodes with age become more intense and more frequent, and without treatment, they can seriously interfere with your life. 7 signs of mania. While mania seems like fun and games, it can be unproductive and even harmful. You will experience intense feelings of happiness and pride and feelings of invincibility. You'll feel like you're Brad Pitt and you'll start to behave accordingly. However, this often results in recklessness and even dangerous behaviours. It's also followed by sleeplessness and racing thoughts, and it can get too much sometimes. That's why you need to find help as soon as you can, despite the happy feelings. Mania can cause other symptoms as well, but 7 of the key signs of this phase of bipolar disorder are 1. Feeling happy or high for long periods of time. 2. Having a decreased need for sleep. 3. Talking very fast, often with racing thoughts. 4. Feeling extremely restless or impulsive. 5. Becoming easily distracted. 6. Having overconfidence in your abilities. And finally 7. Engaging in risky behaviour such as having impulsive sex, gambling with life savings, or even going on big spending sprees. 7 signs of depression. Like mania, depression can cause other symptoms as well, but here are 7 of the key signs of depression from bipolar disorder. 1. Feeling sad or hopeless for long periods of time. The manic period is followed by a prolonged episode of extreme depression. 2. Withdrawing from family and friends. 3. Losing interest in activities that you once enjoyed. You'll find yourself uninterested in things you once found very exciting. 4. Having a significant change in appetite. You're unwilling to eat, sleep, and tend to spend most of your days alone and sad. 5. Feeling severe fatigue or lack of energy. 6. Having problems with memory, concentration, and decision making. Racing thoughts and restlessness are also common. And finally, 7. Thinking about or attempting suicide or having a preoccupation with death. You can see how both of these periods can intervene in your normal everyday life. For bipolar disorder sufferers, finding the balance between the two extremes seems impossible. Mood stabilizers can help you create a balance between the manic and depressive episodes. For type 2 bipolar sufferers, it's common to experience at least one manic period, which is usually followed by a very long, deep period of depression. If you suffer from this type, then you might find it hard to get enough energy to perform even the most mundane, everyday tasks. And because the depressive period is so deep, it's often misdiagnosed as depression. Living with bipolar disorder. About 1 to 3% of the world population is affected by bipolar disorder. The majority of these people are able to find enough balance between the two mood swings to function relatively normally. They are able to complete education, create a family, and get a good job. However, bipolar disorder will still have a great consequence on their ability to live a normal life. For many, the illness will interfere greatly in their personal and professional lives. At their extremes, the mood swings can create a black hole that swallows an individual's personal life, career, financial stability, and other aspects of good living. And once you're in the black hole, it's incredibly difficult to get yourself out of it. Studies show that people suffering from bipolar disorder are more likely to be victims of violence or aggression as a result of their condition. Diagnosis. Bipolar disorders are often misdiagnosed. Too many people mistake bipolar disorders with depression, but in reality, they are two very different things. While both conditions share some similarities, they are separate and distinct mental illnesses. A bipolar disorder sufferer will experience periods of extreme and deep depression. They will also experience manic episodes where they will feel elated and overly energetic. Bipolar sufferers experience mood swings that alternate between manic episodes of high energy and depressive episodes of low energy. For those suffering from depression, the manic periods never come. If you feel like you have a bipolar disorder, then you may want to speak to your doctor, as it's often misdiagnosed. Men with bipolar disorders are usually treated for schizophrenia, while women are diagnosed with depression. Anyone can suffer from bipolar disorder. The onset of the illness is usually in the late teens or early 20s, although there are exceptions. However, no two cases are the same. That's why treatment often depends on the person themselves, but it usually involves medications, care, and other treatment programs. Causes. Research shows that persons with a family history of bipolar disorders are more likely to experience the condition themselves. What you are going through right now might be what your parents went through when they were your age. It's written in the genetic material and is caused by one or more genes. However, the research is still relatively underdeveloped, and it's still not quite clear whether genetics is really the primary factor behind the bipolar disorder. In essence, bipolar disorders are caused by unusual brain activities and uncommon neural pathways. The brain of a normal person connects neural pathways in such a way that we make sensible decisions. For a bipolar disorder sufferer, however, these pathways are extremely confused and unintelligible for the brain. The brain resists and is left scrambling trying to solve these pathways. In reality, the disorder is a complex problem. We can't pinpoint it exactly to just one cause. In a lot of cases, it's a mixture of genetics, brain structure, and negative social experiences that trigger the condition. Treatment. So, you're tired of living like this, but what can you do? Some medications have proven to be very effective in treating bipolar disorder. To be more precise, mood stabilizers can be very effective in holding off manic and depressive periods, making them less intense. Lithium is the most common type of medication, as are any antipsychotics. Various therapies have also proven to be successful. Electroconvulsive therapies have been used on many patients and have had great results. However, this therapy should only be used in extreme cases. The best thing that you can do for your bipolar disorder is to contact your doctor and speak to them. Bipolar disorders are treated on a case-by-case basis. With treatment, your bipolar disorder can enable you to live a better life and experience fewer emotional spikes. In addition, regular exercise and good sleep habits, as well as a proper diet, can alleviate some of the symptoms. And remember, Bipolar disorder is not your fault. It's a medical disorder caused by factors that are not controlled by you. You can alleviate the condition at least slightly with a combination of medications, therapies, and good habits. Are you someone that has bipolar disorder? If so, what triggers do you identify? Or do you know of someone with this mental health condition? Based on your experience, what were your biggest challenges in trying to cope with having bipolar disorder? Let us know down below in the comments. Be sure to subscribe to the Succeeding with Mental Health channel and hit the notification button so you don't miss any of our future videos.